Working here requires a different kind of care. You have to see past the bars and remember everyone is still human.
Welcome to this explainer. Okay, today we are going to completely bypass those exaggerated Hollywood myths and dive straight into the raw, unfiltered reality of healthcare behind bars. We'll be looking through the eyes of RN Jean Jerome, a nurse who has literally been in the trenches of correctional healthcare. It's totally fascinating to see what happens when the traditional rules of medicine get locked inside a completely different universe. Let's get right into it. So, let's just hit this jarring reality right out of the gate. You think you know nursing? Try doing it behind bars. Seriously, nothing, and I mean nothing, in a standard nursing textbook can actually prepare a medical professional for what happens once that heavy steel door clicks shut behind them. It instantly demands a totally different set of survival instincts. Because, nursing schools simply never taught us this stuff. The correctional environment isn't just a clinical space. It's this profound masterclass in human behavior. It challenges literally everything you thought you knew about healthcare, about patients, and honestly, about the very nature of trust. You aren't just treating an ailment anymore. You are treating a person who is deeply embedded in a high-stakes survival ecosystem. Section 1. Beyond the locked door. The threshold. Let's look at the very first massive shock a new nurse runs into. Think about a standard hospital. The patient generally wants help, right? They implicitly trust the medical system to fix them. But the correctional patient? Totally different story. They exist in a world where being honest can actually have terrible consequences. An inmate might intentionally hide really severe, painful withdrawal symptoms, or even claim they are totally fine while actively having a medical episode. Why? Just because they are terrified that admitting to substance use is going to add time to their sentence. It flips the entire medical paradigm completely upside down. Your patient's main goal might literally be at odds with keeping themselves alive. Section 2. The psychological battlefield, the underworld ecosystem. Okay, once you're inside, you are actively navigating this incredibly dense, complex psychological battlefield every single minute of your shift. And here's the thing. Inmates police themselves way harder than the actual correctional officers do. So to survive and actually treat your patients in this deeply ingrained social ecosystem, a nurse has to immediately master diplomacy. You have to learn exactly how to move, how to speak, who gets to eat when, and you absolutely must respect the strict hierarchies of the shot callers. Understanding these unspoken social dynamics isn't just some optional extra credit for a nurse here. It's absolute survival. If you misread the room, well, you lose your ability to provide care entirely. And because of that intense pressure cooker dynamic, you pick up on things super fast. Like patients might lie straight to your face, but their physical bodies, their vital signs, they never lie. You are basically forced into becoming this elite student of body language. You learn to read micro-expressions, those super brief, involuntary facial twitches that reveal what someone is actually feeling deep down. You develop this intense gut instinct for listening to what is not being said. It's human psychology stripped down to its most primal level. Section 3. The hidden cost of noise, the invisible toll. So as you are adapting to the people, the next huge shock hits you. And it's the intense sensory assault of the physical facility itself. At first, you are constantly jumping out of your skin. The echoing yells, the sudden distress calls, the sound of those incredibly heavy metal doors slamming shut, it literally rattles your bones. But then you gradually adapt until you hit step 3, complete desensitization. You don't even flinch. And honestly, that is the truly chilling moment. When you realize you have become totally numb to the overwhelming chaos around you, you also realize that numbness is going to follow you all the way home to your family. And that really anchors a crucial point. A 2026 report from the Health Management Academy dropped this staggering stat. 58% of nurses reported severe burnout. We're talking almost 60%. And it's largely driven by the crazy fact that only 29% of units are actually adequately staffed. Correctional nurses are just incredibly isolated. Imagine being the absolute only medical professional on a massive unit, forced to make life or death calls completely on your own with zero backup. So it's really not just the physical exhaustion of walking the tiers all day, it's moral injury. Carrying the immense, heavy weight of that isolated, high-stakes decision-making, it causes a profound moral injury that fundamentally rewires how a professional views the world. It is a psychological burden that's just completely different from your standard workplace fatigue. Section 4. The predictability paradox, a surprising pivot. All right, I've got a quick question for you based on everything we've talked about so far. If you had to guess, which environment is more chaotic? A standard hospital emergency room or the prison medical unit? Now, most people would instantly say the prison, but the actual truth is so incredibly counterintuitive. The ER is wildly unpredictable. Literally anyone can walk through those doors at any given second with some unimaginable trauma. But the prison, it's a highly controlled population. The daily routines are rigid. The medication passes follow this very steady, predictable rhythm. The baseline of a prison is actually way calmer and more structured than a hospital ER. The chaos really only erupts in these short, super intense bursts, like a sudden fight or a severe mental health crisis. Like we mentioned earlier, it's the mental weight of anticipating that next burst that wears you down, not necessarily the physical pace of the day itself. Section 5, stripped down to humanity, the core revelation. So within that strict, steady routine, you actually get some of the most unexpected moments of the whole job. RN Jerome put it perfectly. You will see people at their absolute lowest, but you'll also see moments of surprising humanity. In this cold, sterile place that is quite literally designed to contain and punish, you end up witnessing raw compassion. You might see an inmate carefully, gently protecting a cellmate who's having a terrifying medical seizure. Or maybe someone just quietly asking the nurse how their family's doing while they get their blood drawn. There is no pretense, no performance. Correctional nursing just completely strips away the superficial veneer of polite society. It lets you see human psychology in its most unfiltered, vulnerable, and totally honest state. You get the good, the bad, and the beautifully complex nature of humanity just bare for all to see. Section 6, the universal takeaway, the masterclass. Surviving this intense descent really transforms a nurse. It leaves them with this universal skill set that is honestly incredibly powerful when applied to everyday life outside those walls. In fact, Jean Jerome actually packaged all these profound, hard-earned lessons into a guide called Social Engineering, the Art of Human Hacking. It's basically this brilliant playbook for understanding hidden motivations and human behavior. And it works whether you are a nurse treating patients, a creator building an audience, or really just someone trying to observe the complex world around you. This playbook dives into how trust fundamentally works and how easily it breaks, right? It teaches you to spot hidden psychological patterns way before they actually manifest, how to master ethical persuasion, and how to navigate those invisible social dynamics at work or just out in public. Think of these tools as a universal elixir. They take the extreme, high-stakes lessons of the prison ecosystem and turn them into highly effective human hatching skills. Skills you can use to successfully navigate literally any social dynamic you bump into in your daily life. Which brings us to our final lingering question. We know correctional nursing completely strips away the pretense of society, but what about you? Are you really paying attention to the nuanced human behavior happening around you right now? I want to leave you with this final thought to carry with you today. Use these concepts to stay sharp, stay human, and never stop observing the hidden realities of the people you interact with every single day. Thanks for hanging out with me for this explainer, and I'll catch you on the next one.